We think about food as affecting your weight or your cholesterol, but I was sitting at my desk one day, and my phone rang, and it was a young woman who said, "Dr. Barnard, I can't get out of bed." I said, "What's the problem?" And many women have some menstrual pain, but for maybe 1 in 10 or so, it's off the scale, cannot function for a day or 2 days. And this was her. So she said, "My mother told me I should call you and you could help me." And so I said, "Well, I can give you some painkillers for a couple of days." But I started to think about what are cramps. And menstrual cramps, to put it simply, are the lining of the uterus is being thickened up every month in anticipation of pregnancy. And it's hormones, it's estrogen that does that. And if you have extra estrogen, female sex hormone, that uterine lining thickens up a whole lot more. And at the end of the month, it all disintegrates in menstrual flow. But as it disintegrates, that thick lining releases prostaglandins that cause cramping. So she's telling me her symptoms, and I thought, wait a minute, I wonder if you got too much estrogen in your blood somehow. It's too high. So I said to her, "How about this? Let's try an experiment. I'll give you painkillers for a couple days, but for the next month, would you like to try a diet that might help? No animal products, keep oils really, really low, foods as natural as possible." 4 weeks later, she called me back and said, "This is astounding. My period came, 0 symptoms, nothing." And then in the months that followed, same story. But then she loosened up her diet a little bit. The pain came back. So I thought, okay, that's one person. So I connected with our friends at the Georgetown University Department of Obstetrics and Gynecology, and we did a research study. We brought in a large group of women. They all had moderate to severe pain every month. We split them into a placebo group, effectively, and a vegan group. And it works. The first thing they noticed is that PMS was different. Bloating and water retention cut way down. And then mood changes that they had been bothered by were reduced. And then when we tracked their pain, it was fewer days and noticeably less intensity. So we thought, okay, that's really important. But Rich, I got to tell you something. In the course of this study, we told all the women, please don't take any hormonal preparations in the course of the study because it's going to goof up our results. And that includes birth control pills. So if you're sexually active, please use some other method because we don't want the hormones to interfere. One of the women said, "Don't worry about me. My husband and I gave up trying to have a baby years ago. And it's not him. We've been tested. It's me. I don't ovulate." She just was not releasing eggs on any kind of predictable basis. The second month that she was on the vegan diet, she came in and said, "Dr. Barnard, I've got bad news and I've got good news." I said, "What is it?" "Well, I'm leaving your study because I am pregnant." Wow. And she was pregnant. And about 8 years later, I was giving a lecture in a different city, and I didn't realize she had moved. She came to my lecture and told me about her 3 kids. What I'm saying is that hormones affect pain, they affect fertility, they affect hormone-related cancers like breast cancer, prostate cancer, so many things. And everybody is whirling these dials on their hormone levels by the food choices they make every day without having any conception of what is happening. So the reason I wrote Your Body in Balance is I thought, well, let's get your body in balance, because all of these things make people miserable. In some cases, they just make you miserable. In other cases, like hormone-related cancers, they can kill you. So let's get this information out there. And the reason that we went full-on vegan is I gave you one example of fiber, but it's not all there is to it. This whole area started being studied, 20 years ago, maybe more, for cancer patients. Breast cancer patients have one thing on their mind, which is, I don't want my cancer to recur. And so researchers have looked at dietary changes that reduce estrogens for cancer patients. And they found 2 things. The first is fiber, which I mentioned earlier. A high fiber diet flushes these estrogens away, quite literally. But the other thing is fat, animal fat, and even oils, vegetable oils. For a reason that I don't know the mechanism, we haven't figured it out. If I take a group of women and I put them on a fatty diet, their estrogen levels rise. And you can do both together. You can say high fiber, low fat, high fat, low fiber, and you can see estrogen levels going up and down very rapidly. So we thought, okay, I don't want any animal fat in your diet at all. That means it's vegan. But we went a step further and kept oils low. So what that means is that everything you're eating has fiber. Everything you're eating is from a plant. There's nothing in your diet that's not a plant. And so you're getting